Hi everyone, it's Sonia here. Welcome to my channel. So what I wanted to talk about here was the breast implant illness and the long list of symptoms. If you have breast implants, um, listen up. Maybe you're going to relate to this. I didn't take it seriously until recently. I wanted to think that my problems were for sure from something else. I didn't really think it was the breast implants because it does seem kind of like, well, how is that possible? So many women get them and they're fine. Well, it turns out they're not all fine. A lot of them have these problems, and a lot of them, most of them, feel better when the implants are removed. I've been dealing with some very weird, mysterious health problems going back almost a decade that I had tried to get help for so many times. And I feel like all I got was, basically gaslit by the doctor most of the time. They just sort of told me, you're under a lot of stress because you have an autistic son and you're a caregiver. Basically, you're a woman, you can't handle stress, or B, you're a woman, you're just anxious, or you're depressed, whatever it is, it's in your head, there's nothing wrong with you. When I tell people I suffer from chronic fatigue, they'll be like, oh yeah, as I'm getting older, I don't have the energy I used to have. After work, I can't go out and party anymore. And I'm like, no, I'm not talking that kind of fatigue. I'm talking like you get up and an hour later you want to go back to bed because your whole body hurts so much and you feel like your whole battery's drained. That kind of fatigue. And for the pain, people be like, oh yeah, since I hit 50, I've got these aches and pains. I have a slipped disc or I've got arthritis. And it's like, no, not that kind of aches and pains. This is like, you feel like you're dying because you don't have those things and your whole body just hurts all the time. And you're like, what the hell is wrong with me? Can I know for sure that my symptoms are from my breast implants? No, I can't. I really don't know what's wrong with me. I know that I have pain all over my body, like I said, and I feel like my battery is very low, no matter what I do. I've tried a lot of things. Maybe I'll do another video about the things I've tried, but trust me, whatever you can think of, I've probably tried it. It's not normal that women are just in full body pain and extreme fatigue all the time, getting worse every year after menopause. Otherwise, they would all have to retire at like 50 years old, and there would be no such thing as like women being active, in middle age, because they'd all be in bed. Okay, so here is a list of symptoms. This is from healingbreastimplantillness.com. I'm going to just read it and I'll let you know which ones I have. And you let me know if you have any of these too, if you have breast implants. Fatigue, yes. Brain fog, memory loss, cognition problems, yes, brain fog. Muscle pain and weakness. No, my pain's not in my muscles. Joint pain of neck, shoulder, back, hip, knee, hands, feet. Yeah, I have pain in my hips, but it's from spondylolisthesis. It's not from my implants. Hair loss, dry hair. Yes. It just breaks. Premature aging of skin. No, I don't think so. Skin itching, various rashes. No. Weight problems. Yes. Inflammation. I don't know. My lab values are supposedly normal, but apparently this is a huge problem with people with breast implants. And yes, I did say people because they're not all women if you think about it, right? Insomnia and poor sleep. Yes. Dry eyes, decline in vision. No, my eyes were always dry. Hypothyroid. Apparently not, but I do have nodules in my thyroid. Adrenal fatigue. I would say yes. Parathyroid problems. I don't think so. Diminishing hormones, early menopause, hysterectomy. Now you guys know I had menopause at 45 years old, which is just on the very cutoff of normal. Now I'm really starting to wonder whether that has something to do with these implants. There's no history of this in my family. Everyone's fertile and has a menopause at like 50, 55. I had all kinds of problems. I'm not sure if the fertility issues on this list. It probably is. I found out later though that it's associated with fertility issues, and I had that. I had to go through 3 rounds of IVF, and I had a low ovarian reserve, poor egg quality in my early 30s. So maybe that was the implants as well. Anyway, that's a yes. Low libido. Wow. I was never a very high libido person, so I won't blame the implants. Slow healing, easy bruising. No. Slow recovery after exercise. Yes. That's why I don't like to exercise, because I go to the gym and then it's like I'm destroyed. Sometimes it's like 2 or 3 days I'm destroyed. Vertigo, I've had that. People were like, oh, it's menopause. I'm kind of wondering now. Headaches, migraines, ocular migraines. No. Throat clearing, cough, difficulty swallowing, choking. Sometimes the throat clearing. Reflux GERD, yes, but I have a hiatal hernia, so I won't blame the implants for that one. Nausea, gastritis, leaky gut, SIBO. Not that I know of. Irritable bowel syndrome. Possibly. Fevers, night sweats, heat intolerance. No, not fevers and night sweats. Heat intolerance. I get heat rash all of a sudden. Now, like, if I go in the sun, I get like, oh, I actually should have put that under rashes. I just figured it was from the sun, though. I don't know. I get like a bubbling rash. And I was like, am I allergic to the sun? I'm recording this now and documenting it so that I will remember what it was that I was dealing with. Because, you know, when things get better, you always forget, right? I want to document this now. And then after I get my implants out, we can look back and see, did it improve? And this will be like my proof, right? Persistent bacterial and viral infections. No. UTI infections, interstitial cystitis. I don't think so, but I do have blood in my urine, so that's kind of weird. Yeast infections, candida, sinusitis, fungal. No. Ear ringing. I did have that for about 10 years, but I think that was because I worked in a call center and it's gone now. Metallic tastes. No, but that would suck. Sudden new food intolerances and allergies. Okay, that's weird. You may remember, if you see my older videos, I did a lot of videos about being gluten-free and that I couldn't deal with eating wheat. And you know what? I eat wheat now because I just can't afford a very perfect, healthy diet with gluten-free, because the price of food is like double and my income is like half of what it was. So, but yeah, it seemed like I have some issues with certain foods that I didn't have before. Heart palpitations, heart changes, heart pain. Now that's weird. I actually went to the doctor. I said, I feel like my heart is beating fast. I'm having palpitations. And I had like pain in here, and they were like, oh, it's just anxiety. Blood pressure problems. Yes. I've had sudden drop in blood pressure where I faint and that my heart rate goes up. So it's like a POTS. Fortunately, I don't have it very often, especially if I stay hydrated. But there's something weird about my blood pressure. Frequent urination. No. Oh, wait. Swollen and tender lymph nodes of breast and underarm. You want to see something weird? I'll show you right now. Wait, I'll have to strip a little bit. I hope you don't mind. Okay. You see that giant, look at that. You can see it, I'm sure. You see that big fat lump under my arm? Do I have one here too? Sorry, I don't shave. Well, I shouldn't say sorry. Like I'm over that. I don't believe in shaving anymore. I think it's kind of counterproductive. It just makes you feel sweatier. So I hope you're not offended. Boho granola hippie chick here. Do I have one on this side? A small one, small, little bit. But this one, look, you can literally see like this giant lump under my arm. So I would say yes, that swollen lymph node or whatever it is under my arm. I did ask about it once and they were like, oh, it's nothing. And I've had it for a long time, so I figure it's not going to kill me. But it is kind of weird. I mean, I've had it for years. Bouts of dehydration for no reason. Well, I do get dehydrated, but I don't know if it's for no reason. Frequent urination. Not really. Thank God. Numbness and tingling in limbs. I've had it a little bit in my hands sometimes, but not that much. Cold and discolored hands and feet. Like Raynaud's? No. Thank God. Thank God. No. Just discomfort, shortness of breath. Yes. You've seen that if you watched my Europe videos. I had a lot of trouble just going up a small slope or like going up some stairs. It's like I was 90 years old. Why? It's weird. And that's just in the last few years. And no, it wasn't because of COVID. I was like that before. Pain or burning around implant or underarm. No, thank God. Liver problems. Mild fatty liver, apparently. Kidney problems. No. Gallbladder problems. No. Pancreatitis. No, thank God. Depression, anxiety, and panic attacks. Yeah. And I had really bad panic attacks about a year ago, and it was so bad. It was so debilitating. I I had like 8 to 10 a day. I mean, there were so many that it was like I couldn't function. I remember one time I tried to leave the house to go to the bank. I went to the end of the block, got to the next end of the block, and it was like I hit a wall. Like I could not even walk. I was just hit. And it just feels like you're dying. It feels like, well, for me, it feels like my heart is, I'm dizzy, first of all. I would get dizzy, my heart would race, my blood pressure would drop, my arms, my hands, and like my legs would be tingling. Actually, they asked about that, and I said no, but yeah. So this tingling feeling, like the blood is leaving my hands, and I just get this horrible feeling of impending doom. And it wasn't related to any kind of fear. It wasn't like I was like, oh, there could be a dog, or what if this or that, right? Nothing. It just would boom, just come out of nowhere. And it wasn't related to like some kind of activity, because it would happen sometimes while I was lying on my bed doing nothing, just scrolling on the iPad or whatever. And I would just get this feeling, and I felt like I was having a stroke or something. It was really scary. The first few times, I mean, I've had them before in my life, but this was much more intense. First, I thought, okay, I'm just gonna faint, because that's what, when I get a faint, I get like dizzy. I feel nauseous, like I'm getting the gastro. Then I feel dizzy, and then I feel like all the strength is leaving me, and like that. I lie down and drink some Gatorade or something, and that might help. I don't know. I feel like that. What else can I do? And then eventually it goes away. So it seemed like it was like I was heading into a faint, but it wouldn't go away, even if I lay down, even if I drank, and it would last a long time, like 20 minutes, half an hour. And I went to see a doctor because I was like, I don't know, something's not right. I feel like my blood pressure is like dropping out, and I feel like I'm going to die. Or I didn't say that to him, but I told him I was really concerned. And they made a referral to psychiatry. Of course, I didn't go. And then on a follow-up, they were like, why did they refer you to psychiatry? And I don't think it's psychiatric. I think there's something off. I thought it was maybe my vagus nerve. I don't really know what it is, but I've had that. And I had so many back to back that it was like, you can't live like that. You can't do anything. Thank God it did go away. They became less frequent and stopped. But yeah, that was a big deal. Feeling like you're dying. Not to be dramatic, but yeah, sometimes. I mean, with the panic attacks, yes, but also in the day-to-day, like feeling like my strength is leaving me, and feeling like I'm just in pain all the time, and like I can't function. I feel like, what the hell is this? Am I dying? I mean, I've kind of convinced myself that I can't be dying, or I would have been dead by now, because I've been like this for 10 years, But yeah, symptoms or diagnosis of fibromyalgia, yes. Symptoms of or diagnosis of EBV and Lyme. Okay, I don't know. Some people have said, do you have Lyme? You can't get tested, and even if I had Lyme, it would have been there a long time ago. It wouldn't even show up. I don't know about that. Symptoms or diagnoses of autoimmune disease such as Raynaud's, no Hashimoto's, no or Addison's disease. Graves' disease, rheumatoid arthritis, scleroderma, lupus, Sjögren's syndrome, unspecified connective tissue disease. Okay, well, yeah, unspecified connective tissue, but that's hypermobility. I've always been like that. POTS, yes. Ankylosing spondylitis, multiple sclerosis, and others. So no, I don't have any of those. And of note, with the Sjögren's syndrome, I saw a woman posting about her recovery, and she was diagnosed with Sjögren's. And after she had her implants out, she no longer has Sjögren's. Associated B-cell lymphoma, breast implant illness, associated squamous cell carcinoma. What? Now that's even new for me. I didn't even know that was one of them. I mean, I know about the lymphoma being associated, but squamous cell carcinoma? No shit. Why do they put these things into women? They literally sew toxic bags into women's bodies, or men if they want them, right? Why do they sew toxic bags into people's bodies? How is this okay? You know, I'm a big libertarian, right? So I kind of feel like if you want toxic bags sewn into your body, you should be allowed to have them, but you need to be able to make an informed decision. Being told, well, there's some risk of infection, you're going to have some pain, you might have capsular contracture, that's not really informed because they don't tell you about all the other stuff. Symptoms or diagnosis of other cancers known to be associated with breast implants, such as melanoma, brain cancer. That's weird because years ago I saw there were studies that showed, I mentioned this before, there were studies that showed women with implants had higher rates of brain cancer, but they were trying to say that it wasn't the implants, it was just something else about these women. They must be doing something else. Oh man, looking back now, it looks like they were really making excuses. Myeloma, respiratory cancer, various breast cancers, various lymphomas, various carcinomas, and sarcomas. So basically all kinds of cancers and autoimmune diseases, plus symptoms related to virtually every part of your body. It's all on the list. Do we know 100% it's from the implants? I guess not. Does any individual know it's 100% from their implants? I don't think so either. But like I said, most women do feel better after. And I've seen a list of what's in these things, and I don't know, I feel really naive now thinking that it literally was just silicone and saline, because there's like dozens of toxic ingredients in there. All right, well, there's the list, and there are the ones that I have now, for the record. Let's hope it gets better. Ugh, I feel like it's like impossible to live like this. Like I can't get anything done. Everything that I have to do, it just feels like it's overwhelming. I feel like I'm just sick, basically. You know when you're sick with like a flu or something? Imagine if you had to like go to work and like deal with a bunch of paperwork and do a bunch of errands and deal with all kinds of stuff, and you're like, oh my God, I can't. Well, I feel like that all the time. Not exactly like a flu, different, but that level of like incapacitation, more than a cold. It's not doable, you know? Anyway, let's see if there was anything else I wanted to say. So, well, there it is. There's the list, and there's the ones that I have, for the record. Let's see if it gets better down the road. I'll let you know. My surgery is on the 21st of April. Pretty much like once I realized that it could be my implants, I made an appointment very quickly, and he gave me a surgery date like 6 weeks later. So everything's moving kind of really fast, and I mean, I gotta, oops. Everything's moving kind of really fast, and I can't even worry about it. Like, I can't even go there mentally because I have to do this, because this isn't doable, and they need to come out anyway. They're too old. Anyway, I wanted to just let you know, like, there's this whole long list of symptoms, and it seems like these things are super toxic. And this is messed up that they don't tell people about it. It's not right. I think a lot of people's lives have been very negatively impacted, even possibly ruined by those implants. So there you go. I just want to let you know. Thanks for joining me in the chat. Thanks for your support on Patreon. Also, if you want to check out my Poshmark, it's called ELGASBAZAAR. I'm going to leave you a link because I'm selling as much of my stuff as I possibly can to raise money for my surgeries, among other things. So if you're in Canada, you can actually buy things from me through Poshmark. And don't worry, if you don't like the price, just hit like or make a bundle or something. Leave me a comment that you're from YouTube. I'll give you a really good discount if you want, you know. But yeah, the ELGASBAZAAR. And that's it. God bless you guys. Thanks for listening, and I'll see you next time.